Episode of the My Pocket Preceptor podcast. I'm here with an amazing guest. Her name is Audrey. She's made so much sacrifices to be on this podcast. She has so many gems to share. Make sure you go and check her out on her social media platforms, which she'll tell you at the end of this video. But kindly help me in welcoming Audrey to the podcast. Can you please tell us a little bit about yourself and what made you get into nursing?
Hi, thank you so much for having me. I'm so grateful and appreciative of this opportunity. I've been a nurse I just celebrated my 3-year anniversary back in April. And
Congratulations.
thank you. I come from a long line of medical professionals, nurses, and CNAs, so it was kind of like inevitable that I would become a nurse. I absolutely adore the profession. I love being a nurse so much. Super cliche, but like I just have a passion for helping people. So I spent most of my career in inpatient oncology, but I just recently transitioned to the outpatient side of things, doing infusions, and it's really nice. I love it.
Excellent. Thank you. So 3 years ago, it seemed as though you started in the height of the pandemic or when the pandemic was going on. What would you say was one of the most key findings that you found about nursing and about yourself during that time?
I would say that it was very difficult. When the pandemic started, it was my senior year of college. We had to switch over to virtual learning. We almost didn't get preceptorships because the hospitals weren't accepting students. Then I was also working part-time as a CNA on the oncology unit. And it was just like, it was scary for sure. But also it kind of like solidified my love for nursing because in all of these uncertain times, we're watching people pass away hourly, it seemed. Hospital admin weren't handling things very well, lack of PPE, everybody was just afraid. We didn't know what was going on. We were just expected to show up to work and keep people alive.
Right?
And throughout all of that, it really like kind of solidified my love for nursing, mostly because of the camaraderie and the sense of like togetherness that all of the hospital staff, the CNAs and the PCTs all had together, because we're kind of all we had. Most
Right.
of the nurses with social distancing and stuff, like a lot of the older nurses that I was working with weren't even living at home because they had, immunocompromised family members, small children. They were living in
Yeah.
hotels. And so like the only sense of community that we had was each other. And it was really nice seeing how well like it went from just general coworker relationship to like true friends because we're
Yeah.
all each other had and we're able to lean on each other. And so it was scary, but I feel like it made me love nursing and kind of prepared me for when I would eventually become a nurse to see like, this is not a profession of glitz and glam.
Right.
Health is can, healthy, just life in general can just happen. And as medical professionals, as first responders, as essential, what was the word they used to call us?
Essential workers.
Essential workers. We didn't
Yeah.
have the option of just not showing up. So
Right.
that kind of really prepared me to be like, okay, rain or storm, rain or shine, snowstorm, global pandemic, sea of uncertainty, you are still a medical professional and you are still required to show up, be professional, and help people, even when you yourself are scared, you don't know what's going on. But yeah,
Wow.
it was a very interesting time.
That's amazing. And I really love how you can pull these gems from it. You pull that it's a lot of collaboration, camaraderie, building lifelong relationships, and then showing up even when it's hard and when you're uncertain. And that can translate into so many areas of our life. So thank you so much. What would you educate a new to practice nurse on doing to help manage their time with their patient load?
Um, I would definitely say something that would help you manage your patient load. One is learning delegation. Learning when to delegate, what patients and what tasks are appropriate to delegate, and not being afraid to do so. One thing that I struggled with a lot as a new grad was just I didn't want to tell people what to do. I had been a CNA for 3 years. I knew what it was like to have lazy nurses or nurses who just did not do anything, and I didn't want to be that person.
Right.
Especially with a lot of the like PCTs that I worked with were my parents' age. And here I am, this 23-year-old child. Like, I
Yeah,
can't tell a grown woman what to do. Um,
exactly.
but, delegation is part of the job, and it makes your day and your ability to provide patient care so much smoother when you're able to have somebody check a blood pressure, check a blood sugar,
Mm-hmm.
take somebody for a walk, set up a meal tray. Having
Yes.
that delegation, that skill of delegation and knowing how to speak to somebody is really, really beneficial, and something that new to practice nurses should really be practicing and learning early on, because it's a vital skill that is needed. Yeah.
I 100% agree, and I couldn't edit anything better. You're giving all the great gems that are tangible that you can use to really, really help to shape your day. So, how do you deal with medication passes? What is your strategy with going with that when you go and get your patient assignment?
Yeah. So for me, I think the way that you set up your day, the first med pass, the first 2 hours of your shift is really make or break to how your day is going to go.
Mm-hmm.
And personally, I like to set up a game plan of knowing not everything about my patients, but having a good understanding of why they're there and what their day is going to look like individually, and how I'll be able to make everybody's individual things coincide with each other. So knowing what procedures they're having done that day, if they're going to be off the floor at any point and stuff like that. Just kind of getting a setup, an idea of what things are going to look like, so then I'm not freaking out when it's noon. I need to hang a 3-hour antibiotic, but just kidding, they have to go downstairs and get a paracentesis.
Which they
Set it
needed
up
the antibiotic to help them so they don't get an infection from.
exactly. So, setting up your day early, having a game plan, and then personally, one thing that I've always done, I was taught by my preceptor, is going from first, always lay eyes on all of your patients. If you're able to do bedside report at your facility, great. But at
Mm-hmm.
least do a quick round on everyone, introduce yourself, and just get an idea of how they're doing. Are they in a lot of pain? Do they need something? Was a task
Mm-hmm.
not finished on another shift and they need to use the bathroom? Having that general idea of how they are, and then kind of formulate how you're going to do your med pass from there. Personally, I will always do lowest acuity to highest acuity. So my more independent patients, the people who have less medications, their assessment won't take as much time, I tend to do them first. That way I get
Mm.
it out of the way, because you can easily get stuck in a more medically complex patient room for like 20-30 minutes if you're having to crush all of their medications, if they have wound care, heaven forbid they
Absolutely.
have a code brown in the middle of everything. um
Highly
it can
likely.
be, yeah, it can be difficult to, like, once you're in that room, you're in there. And if you're in there for a whole bunch of time, you started with them first, and then now your poor independent patient who only takes aspirin and a long acting morphine, it's getting close to almost 2 hours after med pass, and they've just been sitting and waiting, which they're gonna have to do anyways, they're in the hospital. But having them first, getting them over with and getting them settled, will give you ample time to take care of the more complex patients. And also, when you do your complex patients last, you're more likely to have help, because everybody else will already be done with some of their med passes. So if you need help with the reposition, boosting someone, taking somebody to the bathroom, you're more likely to have that help towards the end of the med pass than in the beginning, because in the beginning everybody's focused, laser focused on what they need to do first. You're going to push the call bell and hope that somebody can come in and assist you, and you might not find that help.
Right.
So getting those people done last definitely sometimes allows you opportunity to get other nurses or PCTs in a room with you, to help out.
That is a gem. I didn't even put those two together. That is awesome. That is very, very great. So you're giving such wonderful, valuable information. This is so great. So, what are some things that you would share with a new to practice nurse to build up their resiliency? Because a lot of times you'll face so many challenges in nursing, whether it be the death of your patient, the very first death that you may have to experience, and then the postmortem care or whatever the case may be. You shared on your social media. You're such a fantastic storyteller, by the way. You
Thank you.
share an example of how, your patient had a please explain the viral video that you had, just how so many things could be going on, and then you go into another room and then you're faced with challenges from another patient. If you could just quickly go into that scenario, and then how can the nurse deal with that and not feeling so discouraged as to not even want to show up the next day?
Yeah. So basically what had happened was I had a patient who suffered a massive lower GI bleed. They were independent, on their way to be discharged tomorrow, suffered a massive GI bleed, rapid response, the whole nine. It was terrifying. Not only for the patient, but like for me, I was shocked because I was like, girl, what's going on? Are you okay? Having to deal with all of that it's emotionally taxing, it's physically taxing, and leaving that room, finally getting the patient settled after, 45 minutes, an hour and a half of only being one-to-one with one patient and not knowing if they're going to make it, if you're going to have to send them to the ICU, to then turn around to go in round on the rest of my patients and find a patient angry at me because I forgot to bring them a ginger ale. And it's like, that's so crazy because I literally just had somebody's life in my hands. I was pulling them down from going to meet Jesus, and you're
Right.
getting mad at me because I forgot your ginger ale. And stuff like that can be so disheartening
Mm-hmm.
because you're feeling good about yourself. Like, wow, I just helped this person. I just did, the best that I could to get this person to be okay. And then here I have somebody else getting angry at me for something that's so silly and mundane. Like, I'm
Mm-hmm.
not the only person that could have got you that ginger ale. You could have pushed the call
Right.
bell again, or you could have got up and got it yourself. Your legs work.
They do.
Um, but one thing that I found, because you're going to experience stuff like this, unfortunately, as a nurse, a lot. The state of healthcare right now is a little scary where people aren't compassionate um towards each other anymore, and you're gonna find people who are mean, who are rude, nasty, um and just because like you probably aren't late with something or you've been attentive all night but they just want to be nasty. I
Mm-hmm.
just always try to focus on the good. If there's one singular good thing that happened that day, I'm gonna focus on that and not any of the other BS that happened. But also kind of letting the comments roll off your back. Now, I'm not saying to fold and let somebody cuss you out and be completely disrespectful. Definitely have those boundaries with your patients.
Right.
But
Mm-hmm.
remembering that this person is being mean, whatever, at the end of the day, once my shift is done, I clock out, I'm going home. I don't need to think about it again until the next shift. Like, let those comments
Mm-hmm.
kind of roll off your back. Um, and not let it, like, don't take it personal, I guess would be easier said than done, but just don't take it personal because you're not going to meet, not every single patient is going to be your best friend. Not every single family member is going to like you.
Right.
Not every single doctor is going to mesh well with you. And that's okay. You are a nurse for a reason. You made it through nursing school. You passed your boards. You were hired. You're working on the unit. You have good skills. You have critical thinking skills. You are capable and well in doing your job. Don't allow somebody's nasty comments make you doubt all of that, make you question if you want to be a nurse or if you even want to keep working. Like, just kind of let it slide. Like, if it don't apply, let it fly. Because
Let it
one thing
fly.
that you can do is really get in your head, and I did this a lot, especially working in oncology. I'd say, not say we lost people very often, but like you can have somebody who's fine and then immediately go downhill. And I used to always get like, ask mom is my witness. I would call her every single day crying after a shift because I was like, I did the best that I could for this person and their cancer is back and there's nothing they can do and like whatever. It's like you can get in your head and let it affect you personally, and then you become drained. And it's like you can't
Mm-hmm.
pour from an empty cup. So you
Right.
have to not internalize these things and don't easier said than done, but try not to let it affect your mental health because it's a very slippery slope, especially in nursing, where once you stop prioritizing yourself and start only focusing on work or internalizing those mean comments or, making yourself feel bad because your patient didn't make it or they're not doing well, you're going to just start to resent nursing. You're just not going to be yourself anymore.
Mm-hmm.
And that's something that happens to a lot of new to practice nurses very early on. Um, and it's sad to see. Like, I had some people who I started out with who left the profession. A girlie that I
Mm-hmm.
graduated nursing school with literally didn't even make it off of orientation, and now she works in tech. Like, she was like, I can't do this. And everybody's journey is unique to them. I don't know what
Right.
her exact circumstances were, but like, it's kind of disheartening, you know. We went through
Mm-hmm.
4.5 years of nursing school. We studied so hard to pass the boards,
Right.
and we finally get into the profession. It's like, oh, you know, letting all of these outside factors attack you and make you not like something that you worked so hard for.
Yeah.
But yeah, just kind of, if it don't apply, let it fly, and just prioritize yourself and your mental health. And just don't let those things like stick to you. Think about it. If you want to go in the bathroom and have a good little cry, we've all had
Mm-hmm.
a supply closet cry.
Absolutely.
Do
Yes.
it. Drink a cup of cold water and keep it pushing,
And
because
keep it
you
pushing.
can't internalize all of it, because then you'll never prosper.
So many great gems. Oh my goodness, guys. Make sure you go and follow Audrey on all her social media. She is amazing. She's very entertaining. She's very charismatic. She's very knowledgeable. So what do you do for fun? Seeing that, the nursing profession can be so overwhelming. How do you pour back into Audrey?
I am a self-proclaimed ambassador of enjoyment. So
Love it.
I love fun. I love outside. I love going out and just doing things. Like, I'm a big, like, event girl, party girl. You will find me at a day party. You'll find me at a brunch. Just like
Yes.
hanging out with friends and just doing fun things. Like,
Mm-hmm.
that's my thing. And also traveling.
Love
Um,
it.
like, having hobbies outside of work is what's going to allow you to be a good nurse. Because
Right.
if your entire personality is nursing, you're going to get burnt out. So, like me, I
Mm-hmm.
love to travel. I love to go on trips, visit new countries. And then, like, TikTok. TikTok has been
Yes.
like a very good like outlet. It's been fun. I get to meet wonderful people like you. Make these
Likewise.
great make these great connections.
Yeah.
Yeah, just like having hobbies outside of work. I love to travel. I love social media. Hopefully they don't take TikTok away from us.
I know, right?
But yeah, just, I love outside. I love just having fun. I love a good
And
vibe.
it's so good vibes only. That is so great. So how do you budget that into it? And so we're getting into the last segment of the podcast. We're really talking about finances and learning how to manage your money, because when I started out, that's the most money I had ever made. And I think, to be honest, I was making more money than my parents per hour. And so how do you really manage your finances, and what would you advise like new to practice nurses to do with their money?
Um, when you get that first check and you see it, you're gonna feel like you are on top of the world, that you're making all this money. One, if you can get a financial advisor or have somebody in
Mm-hmm.
your life who is wise with money, definitely talk to them about their savings plans. But having a savings plan is the most important thing. Like, something that I did, it took me a little while to learn this, because I graduated, I got this great job living at my daddy's house. I had no bills other than my phone. I was spending money like it was water.
For real,
But then,
right?
yeah, but then I moved out and I had to start paying rent and utilities. And it's like, oh, I really got a budget. So, like, one thing that I do is, like, every single paycheck, I have my bi-weekly budget of the important things that absolutely need to get paid, things that can potentially wait, and like your fun money. Um, and also something that I do that has been very helpful for me, because I'm very irresponsible, is having separate accounts for different things and allocating your check to automatically go to those separate accounts. So I have a general checkings account where that's just my normal money. I have a bills account where all of my bills are on auto pay from there. And then I have my general savings and I have my fund savings. Having, and like, what I set up my paycheck to have it, a percentage of each check just automatically goes into each of those accounts. And I find that to be beneficial because, one, it's not money that you're missing if you never see it. So if your entire paycheck gets direct deposited into your checking account and now you need to go and allocate $500 towards bills, you're like, dang,
Yeah.
there goes $500. But if it automatically just gets deposited into your bills account, it
Yeah.
was never in your checkings. Maybe other people don't think like this, but in my head, I can't miss money that I never saw. You know? Um, but it helps me stay organized knowing that I have this separate account and it's only for this reason, and I should not be touching this money because it's for actual life bills. And then having the separate savings accounts as well, it's that automatic depositing, because you can plan all you want, but once the money hits your account, if you're not actively going in to transfer that money to your savings, transfer it to whatever, if you just decide one day, hey, I'm just not going to do it this week, now what? Now you don't have anything. Having it automatically deposited into these separate accounts really, really helps me stay organized and like not dip into funds that I know I'm not supposed to. And then having a separate like fun money account of, because I love to travel, one thing that people do, you budget for what you want. Okay. Some people hear how much I travel and they're like, that's just a waste of money. To you, to me, it's not, you
Right.
know? So you budget for the things that you want, you budget for the things that you want to enjoy. So having a separate account specifically for that, also helps as well. Cause like now I know I want to go on a trip. I gotta save up for it.
Right.
It's not just take an entire paycheck and using it to buy a flight. No, you gotta be wise.
Right.
So just kind of allocating, having different funds, different accounts for different things, is a good way to kind of manage your money. And then if you can get into, like, most banks, most institutions have financial advisors available for free that a lot of people don't know about.
Right.
Reach out to your bank, see if you can find, a financial advisor or somebody who can kind of walk you through things, because that could be helpful as well. You can plan as much as you want, but sometimes your plans don't always come to fruition or they don't work out the way you think that they would. And like, adulthood is scary. It's for real. You got to pay that car note. You got to pay your rent. You want somewhere to live.
Right.
So you have to budget for it. You have to budget for it. And having a financial advisor or somebody who can kind of walk you through it, because there's also a lot of things. And I say this for like people that are newer to nursing, who this is their first career. Things like 401ks, things like you know short-term disability, like
Yeah.
things that you don't know
Right.
about until you know.
Right. Life
Having
insurance.
somebody, life insurance, like, these are things that nobody tells you about. You
Absolutely.
don't know to get. All you see is just, they're taking out $50 every check for SDA. I don't know what that is. Like short-term disability, like stuff like that is
Yeah.
like, there's a lot of things that we just don't know about. Oh, another thing too. Sorry, I'm all over the
No,
place.
you're great.
Reach out to HR. Usually, a lot of hospitals, facilities, HRs will have a person who handles specifically everything about life insurance and 401ks and medical insurance and stuff like that. Like, they have people who know all about that stuff, and you can set up an appointment and talk to them about
Right.
it, because open enrollment will come around, and I don't know the difference between an HMO and a PPO and a tier 1, tier 2. I don't know any of that
Right.
stuff, but I went to somebody who was an expert. I attended those info sessions just to get that information, because it's something that you have to take seriously, because life happens, and you want to make sure that you set yourself up for, heaven forbid, you have a massive emergency or something happens. You need to set yourself up to have some sort of cushion or nest egg that you can kind of fall back on. I learned this the hard way, where back in 2022, I had an injury. I tore my ACL. I broke my foot. I was out of work for 6 months.
Wow.
And thankfully, I had a good savings account set up because of, those separate accounts that I had made.
Right.
I had a good savings account set up, so that I could pay my bills and stuff.
Yeah.
But when I had opted in, when I was doing open enrollment, I opted out of short-term disability, because I was like, I don't know what that is. I don't need it. I don't want you taking more money out of my check. Like, thankfully, I live in Massachusetts, where we have a fantastic FMLA, but not all states are like that.
Right.
And so I got lucky, where even though I kind of set myself up for failure by not having short-term disability, FMLA kicked in, but not everybody lives in a state that has a good FMLA. Like, you need to not have it in the front of your mind, but always think that disaster can happen at any moment. And are you ready? Do you have, 2 months worth of rent set up? Heaven forbid you weren't able to work. Or if your car decides to die on you? Do you have an ability to either rent a new one or potentially get a new one? Like, you need to think about not only the enjoyment part of, making all this new money, but
Right.
the responsibility side of it as well. Because we're in a fortunate position as nurses where we make more than a lot of people.
Mm-hmm.
And I don't know everybody's situations, but being in nursing, sometimes it allows you the opportunity to not have to live paycheck to
Mm-hmm.
paycheck. So thinking about that, like, yeah, I have an extra $300. I can go buy a pair of shoes, or I could do whatever. Or maybe, why don't I take some of that and put it away for a rainy day? Like, you got to have a rainy day fund just in case. And if nothing ever happens, praise God.
Amen.
But heaven forbid something does happen, you got to be set up. You got to have at least something to be able to help yourself out, because it's a scary position to be in. I will never forget the day when I found out that my ACL was torn and I had to have surgery, and I was like, what am I going to do?
Wow.
Like, I just moved out of my parents' house. I have rent, I have utilities, I have a car note. Like,
Yeah.
what am I going to do?
Right.
How am I supposed to not work for 6 months and function as a human being? It's a scary position to be
Right.
in. So definitely, like, think about it. Think about those, how life can happen, and have a rainy day fund for sure.
So amazing. Wow, guys, there's gems on top of gems for you to fill up your basket and fill up yourselves. So thank you for sharing all that wealth of knowledge. Is there anything else that you want to share with the new to practice nurse? If not, you've given so much gem already. And then please let them know how they can reach out to you on social media, learn from you even more as you continue to give of yourself and add value on social media.
Just a little word of advice, I guess. You are a nurse. You became a nurse for a reason. You are working at that hospital. You are working in that facility. You passed the boards. You passed nursing school for a reason. You can do it.
Mm-hmm.
Imposter syndrome and self-doubt will really eat you up as a new
Yeah.
grad. But just keep reminding yourself, I am here because I could, and I'm going to continue because I can, you know? And I guess you guys can find me on TikTok, Audrey the Nurse, Instagram, Audrey.the Nurse. Yeah, if you guys ever have any questions, my DMs are always open. I love connecting with people who are in nursing school or new to practice nurses, and I'm always willing to answer any questions, offer advice if I can, or make new friends. But yeah.
Thank you, Audrey. You have been such a blessing. This podcast is going to add so much value to everyone who watches and takes the time to glean from your knowledge. So thank you so much for investing your time. We appreciate you. Remember to like and subscribe and follow us on all social media. Thank you so much, Audrey.
Thank you for
My
having me.
pleasure. Okay, so